welcome to the Digital Health and Fitness Live Studio sponsored by United Healthcare. I am Dr. Eric Eiting here at CES 2017. With me right now, I have Matthew Stoudt. Matthew, welcome.
Well, thanks a lot. I appreciate it, Eric.
Thanks for joining us. So Matthew is the CEO of AppliedVR. So talk to us. AppliedVR, what is that? What do you guys do?
So what we basically do is we're focusing on actually trying to leverage the unique power of VR to bring therapeutic, non-pharmacological solutions to the healthcare marketplace. And initially, we're focusing on a big area that's on a lot of people's minds right now, which is pain and anxiety. And so our initial suite of applications that we've been testing and validating in the marketplace through partners like Cedars-Sinai, Children's Hospital of Los Angeles, and several other top 20 rated hospitals is demonstrating the ability for our VR platform to actually mitigate pain as they're going through procedures. And also, ultimately, we view this as an opportunity to reduce the cost of healthcare. If we can reduce the level of opioid consumption, reduce the level of sedation that a patient receives, then we can get them actually out of the hospital more quickly.
Yep, and honestly, I feel like your timing could not be more spot on because even the Surgeon General, this is sort of their top priority is how do we take opiates out of the equation and make sure that we're not overprescribing these medications. So we're all looking at these alternative solutions to address pain, which is a very real phenomenon, but just throwing opiates at it really doesn't address the underlying issues.
That's exactly right. The other unique thing here is that VR has actually been around for 40 plus years.
Right.
And there's a lot of great clinical research that's been done on to demonstrate the efficacy of VR to actually have an impact. And there was a study that was done almost 30 years ago where they demonstrated how VR could outperform opioids in terms of mitigating pain.
Wow.
The problem was the technology just was in a position where it could never be brought to market and
all
of that.
Yeah.
And now suddenly you've got Samsung, who's is able to deliver an amazing immersive experience with their Samsung Gear, and they selected us as their primary partner on the therapeutic side to be able to bring this to market in a scalable way.
That's really great.
So we've been focusing really hard on both the clinical efficacy side, but also on kind of the workflow design as well. Because that's the other thing I think a lot of people miss, is that when you bring a product to this crazy convoluted healthcare market of ours, you really got to think about how does it actually integrate into their workflow design. Because if it's not optimized for that, it's going to sit in a corner and it's never going to get used.
Right. You were just telling me a story about using VR to help deliver during childbirth.
Yeah, it's, we like to say AppliedVR helps make babies, and probably I should rephrase that. We help deliver babies, make babies.
Right, because listen, I remember going to med school. I don't remember VR being a part of that equation.
Although there is a part of the VR world that actually probably does help that. So it's actually the first of its kind. It was in New York, and a woman had approached her OBGYN and said that she didn't want to actually have to use a regional block and epidural when she was going through, and really wanted to try to give natural childbirth, and it was her second time doing it. So the doctor was using our solution in his practice, offered it up, and we've got some great footage of her actually wearing our VR solution as she's going through childbirth. And the funniest thing is that, so she's in there for about 2.5 hours, and the doctor literally had to remind her to take it off so she didn't actually miss the birth of her daughter as it was coming out. And she actually, after the fact, she said that by far and away, it was actually a better experience than when she had had an epidural for her first one.
Wow, that's
and
really...
so we love that. We
really
love seeing
great.
those types of stories.
God, amazing. All right, Matthew Stoudt, thank you so much for joining us.
Eric, it was a pleasure. Thanks a lot.
Thanks. I'm Eric Eiting here at the Digital Health and Fitness Live Studio, sponsored by United Healthcare at CES 2017.